Presentation. This is something that can be sudden, as after a viral infection, or gradual. I think the best example we all know is Epstein-Barr virus, the period of fatigue that can occur after that and the recovery time that can take place. That there is this kind of acute fatigue syndrome after certain viral illnesses. It was driven home to me in my own family. I was the only one that had chickenpox as a child, and my youngest, who was 2 at the time, gave it to his brother, who was 5 years older, and gave it to his mother. The 2-year-old, if I wasn't spotty, you wouldn't have known there was a thing wrong with him. His elder brother was laid for about a week or so and then back to normal. It took his mother about 8 weeks to get better. So there is as well as seeing it in my clinical practice, it hit home to me that there is a genuine, real post-viral fatigue syndrome. I've seen it happen in people whose health has been good, going along well, index illness, and you see the sudden change. People report that physical illnesses can set it off, and stressful events can set it off as well. It's reckoned about 50% are post-viral, and it can be from a number of viruses. Epstein-Barr is a well-known one, but the Coxsackie viruses can do it, Mycoplasma can do it, and other infectious agents. Right, what kind of things are you looking for? The persistent recurrent fatigue, chronic fatigue syndrome, which is one of the names given to it. So it definitely is one of the star symptoms to be looking out for. But muscle and joint aches and pains are very important too, and in some people that can be a presentation and can be the most dominant symptom. May be present in rest provoked by physical and mental exertion. It's true, people find that mental stress and mental fatigue can be as profound, if not more profound, than physical. But one of the things to look out for is this post-exertional fatigue, not the immediate fatigue, but fatigue that can come on 12, 24 hours later and last for a day or two before going back to their patient's norm. And the substantial reduction in activity levels. The energy envelope is much smaller. It's one that would easily get into ordinary posts and you wouldn't need to pay extra for it. The energy envelope is much smaller. Okay. What else? The current flu-like symptoms, the sore throats, painful glands. Sleep disturbance, either oversleeping or undersleeping, but definitely unrefreshing. Headaches, they can be an exacerbation or they can be of new onset, and I've seen a number of people with facial headaches. I'm not sure how that fits in here. Mm-hmm. Yes, pain as well as pathognomonic of a tension headache, but with facial pain as well. Muscle twitches, spasms, muscle weakness. And another important thing, particularly in younger people that come on to, particularly with schooling, etc., is the fogging of cognition. The attention span is shortened. The short-term memories, it's more difficult to register them, and thoughts get muddled. It's like thinking through treacle, the mental equivalent of walking through treacle. Other symptoms that have been presented to us is perioral and peripheral paresthesia, postural lightheadedness, palpitations and dizziness. Certainly that's one thing when we come on to examination, that it's important if patients do present with these symptoms that the importance of looking at lying and standing blood pressure and pulse. People report quite a marked sensitivity to light and noise. The hyperacusis particularly can be very distressing. There can be a general pallor. There are GI symptoms, nausea, indigestion, and symptoms very akin to irritable bowel syndrome. Other things that people report very much are alcohol intolerance, urinary symptoms, feelings of fever and shivering, and the altered appetite and weight. that altered appetite can go both ways and can swing between one and the other. And weight can be either weight loss or weight gain, and again that can change.